Like every good story, this one begins with once upon a time. Once upon a time, radical abdominal surgeries were performed for gastric and duodenal ulcers. Now they are treated by several weeks of antibiotics instead. Once upon a time, extensive scars and long post-operative recovery periods were the consequence of open abdominal surgeries. Now most abdominal surgeries are performed laparoscopically. Once upon a time, most cardiac patients underwent major cardiothoracic surgery. Now most undergo cardiac catheterization. Minimally invasive procedures are abundant in modern medicine. They have had a profound impact on the way we diagnose and treat patients and have led to true paradigm shifts in many fields of medicine. The surgical arena, including most of its subspecialties, has been one of the leaders in the introduction of such minimally invasive modalities. Now for one more once upon a time. Once upon a time, deep burn victims underwent radical skin excisions. Now most undergo, well, unfortunately, they still mostly undergo radical skin excisions. The treatment of burns, one of the most devastating traumas known to mankind, has not changed dramatically since the introduction of the concept of early excision of burnt skin in the 1970s. The concept of early excision led to the last true paradigm shift in the treatment of burns some 30 to 40 years ago. Burn care is one of the few areas in modern medicine that has not yet benefited substantially from a minimally invasive modality. Current standard of care treatment of deep burns consists mostly of tangentially excising burnt tissue until reaching a viable bed and covering this bed with a skin graft harvested from an area of the patient's unburned skin. Clinical data has shown that such excisions lead to the sacrifice of substantial amounts of viable dermis that exist underneath the burnt epidermal layer and the partially burned dermal layer in partial thickness burns. Viable dermis is an organ with the potential for epithelialization that, if left unharmed on the patient and not excised, could lead to spontaneous healing by epithelial cells growing and migrating out of the skin adnexa, thus minimizing the need for surgical procedures and their consequences. Burn care pioneers in the middle of the 20th century began the quest for a selective debridement agent that would ideally dissolve only the burnt depth of the skin effectively and fast, and would not harm the viable dermis existing under the burn. This quest ultimately resulted in the discovery of Nexobrid, a mixture of proteolytic enzymes enriched in bromelain derived from the stem of the pineapple plant. Preclinical and clinical studies have proved its efficacy in the rapid removal of the burn eschar while unharming viable tissue. These studies have shown that the use of Nexobrid leads to a decrease in the surgical burden on patients, i.e. a decrease in the need to perform surgical tangential excision, a decrease in the need to perform skin grafting, and a consequent decrease in blood loss during these surgical procedures. Data also shows that the use of Nexobrid leads to rapid lowering of burn-induced compartment syndrome, thus potentially obviating the need for performing an escharotomy in circumferentially burnt areas. These data establish the basis for a minimally invasive modality for the treatment of burns that could perhaps lead to a paradigm shift in the field of burn care. And now for the classic end to our story, and they lived happily ever after. Well, not really. We believe our story is only beginning, and well, maybe lived happily ever after is a bit optimistic, but hopefully burn patients will live more happily than before, undergo less aggressive operations, and suffer less scarring. Thank you for your attention.